Welcome back to Velshi and Rule. Members of the House are holding their first congressional hearing on Medicare for All.
It's a health care plan that's been sponsored by more than 100 Democrats, including most of the Democratic presidential candidates. This legislation would create a single-payer, well, sort of, it's a government-funded health care system. This morning's most emotional testimony came from Adi Barkan. He's a health care activist who was diagnosed with ALS at the age of 32.
In this country, the wealthiest in the history of human civilization, we do not have an effective or fair or rational system for delivering that care. I will not belabor the point, because you and your constituents are well aware of the problems: high costs, bad outcomes, mind-boggling bureaucracy, racial disparities, bankruptcies, geographic inequities, and obscene profiteering. A Medicare for All system will save all of us tremendous time. For doctors and nurses and providers, it will mean more time giving high-quality care. And for patients and our families, it will mean less time dealing with a broken healthcare system and more time doing the things we love, together.
Of course, Adi has ALS, so he can't speak, so it's a computer that's speaking for him.
Dr. Kavita Patel joins us now. Kavita is a non-resident fellow at the Brookings Institution and served as former director of policy in the Obama administration, where she helped draft the Obamacare legislation. So she certainly knows this topic best. What is your overall take on the Medicare for All plan?
Yeah, so thanks for having me. I think that the Medicare for All plan, as we saw play out in the hearing today, there's estimates around how much it costs, and it kind of varies pretty widely. But what you heard today was a resounding cry from Republicans as well that we need to do something to fix the current system. As somebody who worked on the Affordable Care Act, I would tell you that what we probably need to do is actually strengthen back the Affordable Care Act and then take very seriously this kind of universal outcry from Americans to do something better. Medicare for All sounds very attractive, Stephanie, but we just have to honestly talk through the details, and what we saw today was exactly that we need to talk through the details.
So let's talk about one detail. There are lots of estimates, as you say, for the cost of this thing. So I'm going to take one from Rand Corporation, in which it says that the total cost of Medicare for All totals $3.89 trillion. The interesting part about this is if you look at the screen, what we pay now amounts to, under current law, is $3.823 trillion. So people who say, oh my God, this is crazy, it's so expensive, it's just that it's more money coming from the government as to more money coming from the federal government, from states, from private insurers, from people out of their own pocket. How do you evaluate that?
Yeah, I mean, the Rand Corporation did, I think, a very logical assessment. And interestingly enough, I think what people don't talk a lot about, because it's just such a kind of wonkish detail, is the fact that Medicare pays less than commercial insurance companies, the people that I get my insurance through, my employer. Medicare pays doctors less. Medicaid pays even less. So in a Medicare for All program, the reason the numbers actually look pretty similar is because what you're paying for all the other kind of employer-based services is actually less in a Medicare system. So getting back to your original question, yeah, I think that Medicare for All is something to be taken very seriously, and I think you're seeing candidates on the field trying to actually talk through some of these issues way beyond the headline.
More and more Americans are saying that they believe health care costs are their family's biggest worry, biggest concern. How would a government-funded system change all of that? Suddenly it's off the table?
No, not necessarily, Stephanie. I mean, we can benefit from looking at what other countries have done. I know sometimes that's very dangerous. In the White House, we look very closely at all the other countries in the world who have a government kind of subsidized funded system. And what they do, what most Americans will feel is that there's at least a safety net. And that's really what Americans want. They want stability. And if you look at other countries, we love to talk about Canada and the UK, but look at other countries like Germany and France. Even with problems in their kind of country's budgets, they've made a priority to say that in our country, health care is a right. And that is something that the United States has not done, but that this debate is forcing.
Kavita, good to talk to you as always. Thank you for joining us. Kavita Patel is the former director of policy in the Obama administration, where she helped draft the Obamacare legislation. Are we out of time?
We are. Busy day.
It has been kind of crazy. All right. Well,
Infrastructure, campaign, Venezuela, healthcare.
remember the infrastructure weeks that used to happen that amounted to nothing in the Trump
Well, guess
administration?
what?
It's kind of interesting to see that we might be making some progress.
We might be making some progress. I will note this morning at the Milken Conference in L.A., the president's chief of staff and OMB director, Mick Mulvaney, said he was not confident that they could get anything done on infrastructure, but that was before the meeting.
Oops. Hey, MSNBC fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down there and click on any of the videos here to watch the latest interviews and highlights. You can get more MSNBC for free every day with our newsletters. Just visit msnbc.com/newsletters to sign up now.